Good afternoon, everyone. Thank you for attending this webinar today on assessing immunization records. I know we still have a few people getting their audio in order. I want to give them just another minute or so to get that set up. It can be a little tricky sometimes. In the meantime, I'll take this opportunity to introduce myself. My name's Kristen Kelly. I'm a health educator here at the Multnomah County Health Department. I have Colton Strickland with me. He is my coworker here, and he's going to be helping monitor the chat box to make sure that all your questions get answered. We are working in WebEx today, and I'm still sort of sorting out all the kinks. We're a little new to WebEx here. But if you have any questions as we go along, please feel free to just type them into the chat box, which should be on the right-hand side of your screen. If you don't have a chat box, if in the upper right-hand corner is an icon that says chat. Hopefully, if you click that, that should open the chat panel. You should also have a participants panel. If you don't see that, again, you can go up and find the participants icon and click on it, and that should open the participants panel. There you should see my name as the host and your own name and a little hand next to it. That would allow you to raise your hand if I should ask you to do that later in our webinar. I may or may not be able to answer all your questions during the webinar. I do want to try and keep it right at 30 minutes. I know you guys have busy schedules, but whatever I can't answer during the presentation portion, I'll stick around for a while afterward and make sure that every question gets answered. So with that, let's get started. Let me start by telling you something that we hear a lot, and that is people will say to us, I know that all our students are up to date because I have records right here for every single one of my kids. And that is great. Having records for every child is a very important first step and, in fact, required by state law. But knowing what's on those records is quite another story, and that's what we're here to work on today, assessing those immunization records. And we know that assessing immunization records is hard. It's not an easy job. And we know that you didn't start your daycare or go to work at a school thinking that you would be asked to determine whether or not a child is due for their next measles shot. But it is so important. If there were an outbreak of, say, measles in Oregon, we and you would need to and want to know which of the kids could be at risk. So today, I want to cover three really important things that will help you assess records in your facility. I want to tell you about the alert database. I want to show you how you can get your students' records from alert. And I want to show you how you can accurately assess those records using transparent overlays and MyPal, the primary review table. I'm going to show you how to do this quickly and confidently because I know you want to make sure your kids are protected and you need to get back to the many other demands of your job. Collecting and keeping immunization records is part and parcel of your job. State law says you need to have an immunization record on file for every kid in your care, but getting parents to give you those updates throughout the year or at the beginning of the next year can definitely be a challenge. The ALERT database can help you with that. ALERT is an online repository of immunization records for Oregonians. Most doctors and clinics in Oregon post all their vaccines that they provide onto ALERT. And you, as daycare providers, preschool owners, and school administrators, you can have access to this tool, and I'm going to talk to you more about how to do that. But for now, do me a favor and raise your virtual hand or press that little icon, hand icon next to your name, if you already have access to ALERT. Raise your hand if you already have access to ALERT. Great. That's great. Good. So for those of you who already have access to ALERT, I'm going to show you a few tricks for working with ALERT. And for those of you who don't yet have access to ALERT, I hope that as soon as this webinar is over, you will request a login to ALERT, and I'm going to show you how. You can get access to Alert by visiting their website at alertiis.org, or the easiest thing to do would just be to call their help desk, and that's this 800 number on your screen right now, the 800-980-9431, or you can send them an email to this email address, alertiis@state.or.us. And just request a login. They're going to ask you to submit a couple of agreements and to watch a little video or attend a short webinar so that you can kind of get some information on how to use it. And it talks a lot about the confidentiality of this information. Now, you're not going to have access to their full medical record, just their immunization records. So once you have access to Alert, let's talk about what to do next. Okay. Once you have access to Alert, you'll just log in, and let me show you. When you log in, I'm already logged in here. This is what you would see. And when you're ready to start looking up your students, you would just click Find Student, and it will take you to this search screen. And you need two pieces of information to search for a child. One of them has to be the birth date. So you would have to have the birthday of the child, and then you can search either on their last name or their first name. Sometimes I'll search, if I have trouble finding it using their last name, I'll try using their first name because maybe their last name has a funny spelling or tricky spelling, I mean. Let's practice doing that right now. I'm going to look for a pretend student of mine, and his name is Winter Snowflake, and his birth date is 5/19/2013. And I just need to type in the first few letters of his last name and click Find, and it'll look through the database and bring up, if there's more than one student who matches that criteria, it'll give me a little list, but in this case there's just one, and it takes me right to his record, Winter Snowflake. And what we see here is a format that's very useful for doctors, nurses, clinicians, but it doesn't mean a lot to you or me. So I go up to this button, School Record button in the upper right-hand corner, and click it, and it reformats the information into a format that you're much more familiar with, the CIS form. And this is the form that you need to have on file for each of your children. And so from here, you can just print this right out. And I'm going to tell you a little trick about printing this out. And I do recommend that you print out all your CIS forms for the assessment process, in part because we're going to be making some notes on it, but also because if a child is incomplete or doesn't have all their shots, you're going to need to send us a copy of that record anyway, so you'll already have it printed out. But a little trick, we're going to be using transparent overlays to assess this record, and if your print dialog box has this fit to page, uncheck that. It changes, for some reason, it changes the size of the document just enough that our overlays don't fit very well. So uncheck the fit to page or best fit checkbox if there is one, then it'll fit with those overlays. That drove me crazy for the longest time. And then you can just print it from here. A couple things I want to tell you about the CIS form that comes from Alert. As you know, a CIS form has two sides or two pages. The front has the required immunizations, and this is the part that we will be assessing. The back, or the second page, has the recommended vaccines, and those are also tracked in Alert, but you don't need to assess those. Those aren't required for school. Medical exemptions, which are pretty rare, but those are also not tracked in Alert. Those are kept on file here at the county health department. So if you feel like one of your students may have a medical exemption, contact us and we'll see if it's on file with us. Also, non-medical exemptions are not tracked in Alert. Those are kept on file with you at your facility, and we'll talk a little bit more about non-medical exemptions in just a little bit. Okay, once you've printed the CIS form, we can just hit the back button, and it brings us back to the form. Now I can just go ahead and start searching for another student, or before I do that, I can go ahead and add this student to a list that you've created. I created a list here called IMMU Reporting 2017, and I'm going to add Winter Snowflake to that list. And I'll click on Manage List here and show you. What that does is allows you to kind of sort your kids or keep your kids sorted in these lists. Here you can see, here's my IMMU Reporting report, and it already has Winter Snowflake listed in it. The great thing about this is you can collect all your kids into a report, and then you don't have to search for them again. Every time that you need to find them, you can just click on it right here in the report. It takes you directly to the most updated version of that report. You can create a new report just by typing in the name of the report. Some people like to use the class of 2021 or whatever. Create that report, and then you can just start putting kids into it right away. All right, let's find another student. Now we're going to find Spring Rain is her name. I just need to type in the first few letters, and her birth date is 9/13/2014. Click Find. Again, it brings it up into this first format. I'm going to click the school record button, which creates the CIS form. From here, I can print it. It remembered that I don't want to fit it to the page. Click Print. And I can add this student to my list as well, and so forth. And I would just continue like that until I've got all my kids' records printed from Alert. If you have handwritten records, I recommend making a photocopy of those for the assessing process as well. And let's do that. Let's practice assessing records. Let's get back over here. When you're faced with a stack of immunization records in the winter, it can feel a little overwhelming to think you need to assess every single one of them, figure out which kids are up to date, which aren't. I know you're probably not medical experts. Maybe you are. I don't know. But that's why I want to show you 3 very powerful tools that you will need so that you can confidently report on those students. The first one is Alert. We just covered that, so you've got that one down. The second key tool is a set of transparent overlays. They were created by the state of Oregon to help you quickly see which shots are required for different age groups. If you don't own a copy of these overlays, please type your name and your facility's name in the chat box right now, and then my office can send a set out to you today. We'll send them out right away. The third tool that I use all the time is my primary review table. And I think once you know how to use it, I think you're going to love it as much as I do. You should have received one of those in your packet from the state. If you didn't, I'm going to give you a whole bunch of links at the end of this webinar, and one of them will be for the an online version of the primary review table. All right, let's dive in. Okay, I've got a few records here, the 2 that I just printed from Alert, and we'll start by assessing those. Notice that when they get printed from Alert, it says down at the bottom here that they were printed from the Alert IIS. And what that does is it means that you don't have to have a parent's signature. This is a valid immunization record, and you needn't have the parent sign it. If, however, a parent amends this, maybe there's something that isn't reflected in Alert, and they want to write in another date, then they need to put an update signature and date just here. Okay, now when I sit down to immunize or to assess immunization records, I need to know how old these kids are because my overlays are for different age groups. The overlays, there are 4 overlays. They cover several different age groups. This one is for babies. I wrote in the different age groups that this one covers because that's kind of hard to read. And then there's an overlay for preschool age kids, 18 months through the age of kindergarten. Then we've got school age kids, kindergarten through 6th grade, and then we've got another one for older kids all the way up to high school. And when we sit down to assess the records, we need to know how old these kids are. We need to know which of those age groups they fit into. And we need to know what age group they will fit into on the reporting deadline. And that's important because if you're sitting down to assess a record for a child who's, say, 17 months old and it's December, you're assessing the records in December, but on the date that the report is due, and this year our report will be due January 11th, 2017, if by that date they're 18 months old, there are some additional shots that they're going to be required to have. So it's important that we know how old will the child be on the first reporting deadline. So let's take a look at that. Here's Winter Snowflake. Winter Snowflake's birthday is May of 2013. That means he is about, 3.5 years old. So he will fall into that 18 months to kindergarten window. And I just write that on there. It helps me keep track of everybody's age group, especially if I'm working with a group of babies and everything as well. So the overlay that I'm going to use to assess that record is the 18 months to kindergarten overlay. It's the one with the little building blocks down on the bottom. And when I lay the overlay onto the CIS form, you can see that the shaded boxes should lay right on top of the required doses that this child should have for this age group. We're looking to see dates under each of those shaded boxes. And in this case, we do. That's great. That means that Winter Snowflake is totally up to date on his immunizations for his age. So I'm going to write a little note up here that he is up to date, UTD. And I do this because later when we go to fill out the report, we do need to get a tally of all the kids who are up to date, all the kids who aren't, and this is just my way of reminding myself which is which. All right, let's do another one. Let's take a look at, here's a handwritten immunization record that was given to me by a parent. It's signed and dated by the parent, so it's a valid immunization record. Summer Breeze, and Summer Breeze's birthday is December 2013. That means she's just over 3 years old and will be on the reporting day. So that puts her in that 18 months to kindergarten time frame or age group. So I'm going to use the same overlay that I used before, the one with the building blocks on it, and lay it on top of that immunization record. And when I look now, I can see that there's dates under most of those shaded boxes, but there are 2 places, sorry for the glare there, sorry about that. There are 2 spots that don't have dates that should. That 3rd dose of polio and the dose of MMR, or measles, mumps, rubella. So I'm just going to circle those on my CIS form, the Xerox copy of the CIS form. So the first thing I do when I'm faced with some empty boxes, the first thing I always do is check the back for non-medical exemptions. And look at that. I see that there is a non-medical exemption for this child for measles, mumps, rubella. So now a non-medical exemption has 2 parts. The first part is the back of the CIS form should be signed and dated with the vaccine marked that they wish to take the exemption for. And we've got that. The second piece that they need to have is a vaccine education certificate. And a vaccine education certificate could come either from a healthcare practitioner or from the online videos offered by the state of Oregon. A parent can watch those videos and print out a vaccine education certificate showing that they got the education by watching those videos. They're very similar in that the immunizations are listed and they are marked if they got the education. And they should have a signature of the doctor, or if they came from the video, it will be a printout from the video. They should have this child's name and birth date and the Oregon Health Authority's logo there. All right, so I do have both for this child. I've got, so that is a valid non-medical exemption for measles, mumps, and rubella. So I'm going to make a note of that here, that they have a non-medical exemption. But that still leaves the blank on polio for dose 3 of polio. So this is where the primary review table comes in handy. So over on the right side of the screen here, I've got the primary review table. I'm going to show you how to use it. I'm going to get to the polio page. That's the first thing you do. The next thing we need to know is how many doses of polio the child already has. She's got 2 doses of polio already, so we can scan down to this section, and then we can begin reading these statements in order until we find the first true statement. So let's do that together. This first one says, dose number 2 was received less than 12 months ago. Well, her last dose was given back in 2014, so that's more than 12 months ago. So that is not true. Let's move on to the next statement. The next statement says that the child is less than 18 months of age. Well, that's not true because we know that this child is greater than 18 months of age. So that's not true. Let's move on to the next one. The next one says that dose number 2 was received 12 or more months ago. Yes, that's true. And the child is less than 18 years of age. Yes, that's true. So this statement is true. And as we scan across, we can see that that means that they are incomplete. They do need to get that shot. So I'm just going to make a little note here that this is incomplete, and I will mark this record as incomplete. Okay, let's do one last one for practice here. Oh, here's a sample of vaccine education certificate for a different child that came from the videos. And you can see that the videos that they watched have check marks. The videos that they didn't watch are crossed out. That's how you know which vaccines they wish to take the exemption for. And then they would, the parent would then handwrite in the child's name and birth date here. Okay, so here's our next record to assess. This is Spring Rain, and Spring Rain is, I don't know, about 2.5 years old. So she also falls into that 18-month to kindergarten age range. I'm going to use the same overlay I used before. Again, I can see that most, oh, sorry about that, darn glare. Okay, most of the boxes are filled in except for dose number 4 of DTaP is blank. So I'm going to circle that. First thing I always do is check for a non-medical exemption. There's none, and I don't have any other paperwork for this one. So no non-medical exemption, blank spot means we go to the primary review table. This time, I'm going to have you read, if you can, if it's not too small, try and read the primary review table and figure out whether you think this child is up to date for DTaP or incomplete. The child already has 3 doses, so you'll scan down to here. The last dose was given March 17th, 2016. So if you think this child is up to date for DTaP, type UTD into the chat box. If you think she's incomplete, type INC into the chat box. use your primary review table and let me know, or I'll give you just a minute to read through that. Nice work, assessors. If you typed up to date, you'd be right. She is indeed up to date, and let's take a look at it together. Since she already has 3 doses, if we scan down here and start reading these in order, the first one says that dose 3 was received at or after the 7th birthday. Well, we know she's not even 7 years old yet, so that's not true. We'll go to the next one. Dose 3 received less than 12 months ago. Aha, yes, that's true. It was given less than 12 months ago, just this past March. So therefore, she is up to date and no shot is needed. So sometimes a child can be up to date without having all 4 doses, if the primary review table tells us so. So she is as up to date as she can be. I'm going to make myself a little note here and mark this as up to date. All right, good. So you would continue in that fashion. Hold on, let me get back here. You'd continue in that fashion, doing all your immunization records. Then you'll count them up, count up how many you have that are up to date. You'll also have some that are up to date with non-medical exemptions. So they may have a non-medical exemption that allows that child to be up to date. And you'll have the incompletes, some of them with non-medical exemptions, like in our example, some without. And then you'll transfer all of those numbers to Section A of the report. So let me just sort of scooch this over here so you can see Section A of the report. All right, can everybody see that? Hopefully you can see that. Oops, now, the reports are available on the State of Oregon's website as fillable PDFs. So you can just type in your information, you can type in your numbers, and just save them to your computer. And then you can either attach those to an email to us, or you can print them out, scan them, whatever you like, and either mail them or fax them to us. So you would type your enrollment numbers up in these boxes, your total enrollment less the children that don't get counted. That number is the children who get counted somewhere else. Maybe they just come to you after school. They're being counted at their schools. And then this is your adjusted enrollment. That's total minus children not counted. The number of complete or up to date, those are all those kids who are up to date. These are the ones who are up to date with non-medical exemptions. Then you've got your medical exemptions, which are rare. And then here we have the number of children who are incomplete, who didn't have all the shots that they needed or the exemptions required. And this last one is for the number of kids for whom you have no record at all. Hopefully you have an immunization record for all your kids, but if not, you would include them there. Then for the kids who were incomplete or the kids who have no record, you would list those kids on page 2. If all your kids are up to date, you needn't fill out page 2 at all. But it's important, if you do have kids who are not up to date, that you give us their name and their birth date and grade, if applicable. And then we also need to have a current mailing address. You'll just just fill out this section B here. You needn't fill out C and D. That'll happen a little bit later in the process. Be sure and attach copies of any of the immunization records for any of the kids you list in section B. Once you've done that, you can email that to us, you can fax it to us, or you can mail it to us, although it's getting a little late for mail because it does need to be in our offices by 1 week from yesterday, so January 11th. But definitely give us a call if you have any questions. We are always available to help. That number right there is our hotline. Most likely you'll leave a message there, but we check it all through the day. So we will definitely be back in touch with you. You can also send us an email to this address up at the top. We also monitor that all day. So we will get back to you just as quickly as we can.